All right, ladies, I wanted to record this video because I've been finding that many of us are struggling with some rib pain as our babies start to press up and grow. I know I've experienced it. It depends on where your baby's resting, on how much you do experience this pain, but I wanted to give you a few strategies on how to help with that tension and some of that pressure, okay? So obviously I can't remove the belly, remove that baby and, get him way down, him or her, way down from those ribs. However, whenever you add in some gentle movements, it does kind of help baby shift a little bit lower, but also helps with some of that tension and some of that connective tissue that can start to tense up around the rib cage into your diaphragm. So take your hands to your knees. Bring your shoulders forward, press the ribs back, tuck your bum under, take your chin to your chest. And inhale, roll up, open chest, take your chin high. Doing this a couple times. And then as you move, I want you to start dialing in on these ribs. Press the ribs back, like think of Pillsbury Doughboy. Whenever they come up and kind of poke, Pillsbury Doughboy it. So you're gonna press back and just really poke those ribs back and then pull them forward. Pull it back. Pull the ribs forward, pull it back. So it's more of, we're focusing right here versus maybe the tailbone or the shoulders, okay? So kind of shift that focus. Exhale, inhale, exhale, inhale, exhale. Doing this, whenever you feel kind of that tension, will really help. Now for lateral shifting. So I want you to take your hands to your ribs, lift one rib, depress the other. So you kind of see how I teeter-totter. And now back to center. Other side, lift and lower the opposite and center. Now why I have your hands right here is because sometimes, I'm gonna show you what's wrong, we do the shoulders. And so we just lift and lower the shoulders, which is fine. And we'll do that here in a second. But I first wanna get this lateral tissue on either side, just underneath the ribs moving. Okay, so we really want to peel these ribs up and down. Peel these ribs up and down. That way we're creating space between our ribs and our pelvis. Because the pelvis isn't gonna go anywhere, right? It's down on the ground, but we can lift these ribs and get the tissues working side to side. And now let's do a little rotation. Hands to your shoulders. Elbows are down. You're gonna take this elbow and peel it forward and then back to center. Other elbow peeled forward and back to center. Keep those elbows down though, because here's what I don't want to see. Now we're rotating from the shoulders, which is fine, but you're not going to get as much movement for that mid belly, upper ribs, lower ribs, upper belly, back to center. That's what we want. We want to get the movement here, okay? So translation right here. If you need your hands on your ribs, maybe try that. Otherwise, keep it here, okay? Again, you can match this with your breath if you'd like. Inhaling, exhaling, in, out, in, out. So try that one. So again, we've gone forward, back, side to side, and then rotated, trying to focus right here in the mid-belly. I hope that those 3 exercises help you. Let me know, and we will chat soon. Bye for now.